Good evening, everybody. My name is Supriti Bihuria. Welcome to our Building Bridges series. As I said, my name is Supriti Bihuria. I am a preventative cardiologist at Northwell Health. I work out of Staten Island University Hospital, and today it is my absolute pleasure to introduce Dr. Ehi Akabue, who will be giving us our Building Bridges lecture today. Dr. Kabue is an associate professor in the Department of Cardiology at the Zucker School of Medicine at Hofstra, a part of Northwell Health. He is a preventative cardiologist in Northwell Health Center for Heart Disease Prevention and Advanced Lipid Disorders. Dr. Kabue will be presenting our topic today, which is high blood pressure or hypertension, taking control of the silent killer. I just want to remind everybody to please put your questions in the chat. And once Dr. Akaboy finishes speaking, we can go over those questions. Thank you so much, Dr. Akaboy, for giving us this talk.
All right, great. No, thanks for the introduction. And the key here is that everybody learns everything, and definitely want to ask any questions that you have. So, without further ado, I'm going to get started. What we're going to go over here is first, what is high blood pressure? So that may seem like a simple question, but it's actually a lot of people don't actually know what defines high blood pressure. We want to know our numbers and risk factors, and then what tools do we have to take control in terms of managing high blood pressure? So, what is high blood pressure? Blood pressure is the force of blood as it pumps against the vessels in your vessels in your blood vessels. So, when your heart beeps, it pumps blood into your blood vessels. This creates pressure against the blood vessel walls, causing your blood to flow to all parts of your body. And in high blood pressure, which is also called hypertension, that's when the pressure is consistently too high against the blood vessels. So we want to understand what our numbers mean in terms of blood pressure. So there's a top number, the number on top called the systolic blood pressure. And that shows how much pressure is being pushed against your walls when your heart beats. And then the bottom number is called diastolic blood pressure. And that shows how much pressure your blood is pushing against your arterial walls while the heart is resting between beats. Okay, so with our blood pressure, we always get two numbers, which we can call the top number and the bottom number. So you're definitely not alone if you have high blood pressure. High blood pressure is often called the silent killer because it has no clear symptoms. Almost half of American adults and that's defined of 20 years or above in terms of the data, have high blood pressure. And many people don't even know that they have it. So we want to know what our blood pressure numbers are. And so a normal blood pressure is here in the green. And the top number is generally between 100 and 120, and the bottom number is less than 80. Once we start getting that top number 130 or above, and the bottom number 80 or above, that's how we define high blood pressure. And this is on average because everybody's blood pressure does vary a little bit when we're at rest. So this is based on what your blood pressure is when you're nice and relaxed and at rest, not when you've just exercised or carried anything. This is what blood pressure is in the categories based on, we base it on rest blood pressures. So once we start getting into higher numbers, then we get into these later stages of hypertension or high blood pressure. So one thing that a lot of people, a good amount of people say sometimes is, my personal pressure is normally that 140 over 90. And if nobody ever educates us or tells us that that's actually high blood pressure, just because your pressure is normally in that range doesn't mean it's normal. And the problem is that it can be causing damage to your organs all the time, even though you don't feel anything. So, uncontrolled high blood pressure can have many consequences. That includes things like heart disease, including blockages in our heart arteries called coronary artery disease, atrial fibrillation, which is an abnormal heart rhythm, and heart failure, where the heart doesn't pump as well as it normally should. So you see this illustration here. High blood pressure can cause stroke. High blood pressure can cause dementia, vision loss, heart attack, kidney disease, in sexual dysfunction. High blood pressure can affect nearly every organ in the body. And again, unfortunately, most people do not have high blood pressure symptoms as this damage to the organs is occurring. So we want to be aware of high blood pressure and the effect that it can have on our sexual health. It's something like, for example, for males, erectile dysfunction is common in men with high blood pressure, but also some high blood pressure medications can cause erectile dysfunction. So treating the high blood pressure, making sure we're adjusting our medications and working with our doctors. And you can talk to your health care professional about that. So that's something important that sometimes people don't feel comfortable talking about. And the same thing goes for women. High blood pressure can also affect women's sexual health. And that can be connected to the changes that the high blood pressure makes on the blood vessels, hormones. It can be related to age. And again, medications can also, for the same medications that we use to treat high blood pressure, can also have an effect. So that's some conversation you definitely want to have with your healthcare provider. So, what are the risk factors that put people at risk of having high blood pressures? Some of these factors are not within our control. So, for example, a family history in our parents for high blood pressure, that can make us higher risk. Certain race and ethnicities have a higher a percentage of people who have high blood pressure. So it can be more common among certain race and ethnicities. As we get older, high blood pressure becomes more common. Men are at higher risk of developing high blood pressure at younger ages. And then once we get to around 65 or older, then women are more likely to get high blood pressure if they don't already have it. If we have some chronic kidney disease, that can cause lead to higher pressure. And if we have any issues with sleep, not getting good quality sleep, having conditions such as something called sleep apnea, where we actually briefly stop breathing in our sleep. This is not something that somebody would be aware of themselves, but it can be marked by snoring or somebody living in the house noticing the snoring or things like that. And that can lead to high blood pressure. So there are many factors, though, that are within our control. So, for example, drinking a lot of alcohol, cigarette smoking, some medications that people take, such as anti-inflammatory drugs. Um, Large amounts of caffeine can drive high blood pressure. That doesn't mean you can't have a cup of coffee, but caffeine can be in a lot of things like energy drinks or and in higher amounts depending on the type of coffee you're drinking. So if you're drinking multiple cups of coffee a day or taking in other sources of caffeine, that definitely can contribute. Things that we use when we have some, for example, sinus congestion. So decongestants can contain something called phenylephrine or some other different various names that can be given that can help with congestion, but also can cause the blood pressure to go up severely. And then we want to make sure we're managing things like our weight, our cholesterol, our diet, diabetes, and making sure we're physically active. All those things are within our control to control our blood pressure. So, um, taking the blood pressure at home, especially when we diagnosed with high blood pressure, is actually very important. And that's because we know that the pressures that people have outside of the office actually correlate better to how their pressure is doing and actually how that relates to what we call outcomes as a result of the high blood pressure. So if it's possible, I always encourage people to get a blood pressure machine. We want to make sure we get the machine that has the cuff that goes around the arm. or the bicep. That's preferred. And it's really important that we make sure we check our pressure correctly and that we're using a machine that is validated. So any machine off Amazon, just because it's digital doesn't mean it's accurate. So we want to make sure that we have an accurate, a validated blood pressure machine and that we're checking our pressure correctly. So what does that mean? We want to mean that we want to make sure we're properly positioned in a chair with our feet on the ground, with a back. We want to make sure our arms are around the level of our heart. So sometimes that means we have to prop it up on a table or something like that. We want to be nice and relaxed, not having had just any caffeine or smoked or alcohol, not just having carried groceries up the stairs. We want to make sure our bladder's empty. We want to make sure we're sitting quiet in a room for 5 minutes. We want to make sure we're not talking during our blood pressure. We want to make sure that somebody's not talking to us while our blood pressure is being checked. And we also want to make sure we're not just taking one measurement and making our conclusions off that. We want to take at least two measurements 1 minute apart, okay? And then you want to record those. Sometimes a machine saves it for you. Sometimes there's apps that sends it to your phone, or you can just write it down. And again, this is very useful information, especially for those of us who manage high blood pressure all the time, to know what's going on at home. So when should you call your healthcare professional? So severe high blood pressure, we define as anything higher, the top number, anything higher than 180, or the bottom number, pretty much above 120. That's very, very high. And in those cases, we want to make sure we're calling our doctor. And when should we call 911, which in terms of a potential high blood pressure or hypertensive emergency, when those pressures are very high, that top number is 180 or more, that bottom number higher than 120, which is quite high, and you're having any symptoms like chest pain or shortness of breath, back pain, numbness, change in vision, that's when you want to call 911 right away. So how do we manage high blood pressure, also known as hypertension? So we define stage 1 high blood pressure as here in the orange, okay? So that's when our top number is between 130 and 139, or the bottom number is between 80 and 89. We call that stage 1. So for many people, your doctor may advise some lifestyle changes alone for about 6 months. And then if the blood pressure doesn't get to goal, which is down here in the yellow or green, then at that point, in many people, we would suggest starting a blood pressure medication. Stage 2 high blood pressure is here in the red or above. And that's when our top number is 140 or higher, or that bottom number is 90 or higher. Notice I'm saying or in all these situations, because some people, it may be the bottom number that's more of an issue than the top number, and vice versa, the top number more than the bottom number. Especially as we get older, this bottom number tends to come down on its own. And that has to do with sort of how the vessels change over time. So systolic high blood pressure tends to be more of an issue as we get older. So that doesn't mean just because one of the numbers is high doesn't mean we're okay. It's either or. So in this stage 2, that's when we start blood pressure medication, because lifestyle changes alone is not going to be sufficient to bring down the blood pressure. We still want to do those lifestyle changes. And most people at this level will require 2 medications to control the blood pressure. So the goal for high blood pressure is to get it down here, like I mentioned, in the yellow or green, to get it on average less than 130 over 80. And we know that if we get down to those levels, that helps reduce the risk of some of these things that I mentioned, like stroke and heart attack and kidney disease. And this has been studied. If it's possible, we even want to aim for down here in the green, which is a completely normal blood pressure. That has been studied in clinical trials. And if we get people down here into the green, it's actually been shown to significantly reduce the chance, the consequences from high blood pressure, such as heart attack. So our goal is to get us down here in the yellow or green with lifestyle changes and medication, depending on what stage we're at. So we lifestyle changes are very important, and that can include multiple different things. We want to make sure we're having a healthy diet, reducing our salt intake, but not only reducing our salt intake, but making sure we're getting more potassium-rich foods. Certain people need to be a little bit careful about getting higher potassium in their diet, like people with kidney disease. So definitely want to have a conversation with your doctor. But for most people, getting more potassium in your diet actually helps to lower your blood pressure. Limiting or avoiding alcohol, making sure we're getting active, managing stress, being a healthy weight, not smoking, and then managing our medications that can drive high blood pressure and also supplements and making sure your doctor knows what supplements we're taking. So, um, I wanted to just point out the importance of being aware of how much salt we're taking in. So this is an example of a nutrition label, which I would encourage everybody who's not already doing it to get into the habit of looking, because salt is in everything. It's hidden in basically everything. And sometimes things are really high in salt, even though we might not think about them as a salty food. So on the nutrition label, there's something, a line always that says sodium, and we want to look at that level. For most people, you don't want to get more than 1,500 to 2,000 milligrams of sodium in your diet. So you can see here that this particular food in one serving has 160 milligrams of sodium, which is about 7% of your daily value. And the nutrition label will tell you this. It is very easy to get too much salt in our diet, especially if we're eating a lot of processed foods. Just as an illustration, a quarter of a teaspoon of table salt is 575 milligrams of sodium. Let me translate that to you. A quarter of a teaspoon of salt, okay, so think of a teaspoon and a quarter of that. That's about 25% your daily value of salt for the entire day. So think about that. One teaspoon of salt is a little bit more than your entire salt for the day. So that just tells you how easy it is to get too much salt. So if we're eating out and we're eating a lot of processed foods, you can see how easy it is to get too much salt. And some people are very, very salt sensitive in terms of their blood pressure. So we want to consider in terms of salt, replacing the salt. So, for example, there's a lot of potassium-based salt substitutes out there, and we also want to pay attention to potassium-rich foods and getting more of those because we know that helps to bring the pressure down. And that's found in a lot of foods. This is just an example. And so I encourage people to find a food that's potassium rich that you like and get more of those foods in your diet in a healthy manner. So some examples are spinach and squash and some many other foods. So very important in terms of managing your high blood pressure is making sure we're getting active. So even moderate activities such as brisk walking is beneficial. So we definitely don't need to be like LeBron James or a professional athlete to get cardiovascular benefit. The goal is a total of 150 minutes per week of moderate intensity aerobic exercise or 75 minutes a total per week of vigorous aerobic exercise or a combination of both. However, these are very important guidelines, and we know that getting to those levels are definitely beneficial, but you definitely can get benefit at lower levels. And I encourage people not to be discouraged by those numbers, which seem a lot if you're not exercising routinely. I tell people, why don't you start by taking a walk 20 to 30 minutes 3 times a week, or doing some activity that you like. Maybe you like taking a class. Maybe you like biking. Maybe you like a fitness class. Any of those things count. And we can start slow and build up over time, and we still get cardiovascular benefit from that. Most healthy adults don't need clearance from a healthcare professional before starting exercise, but there are some adults with chronic illnesses in other situations like pregnancy where we should make sure we're checking with our healthcare professional first. So definitely think of things that we like. You're more likely to continue doing those things and to stay on top of it if it's something that you like doing. Okay. Um, so how do these things that we can change with our lifestyle affect the blood pressure? So it can actually affect it a lot. So I just want to show you this here. I don't want you to add these numbers up together. These numbers are what the expected change on average would be for these lifestyle changes. So, for example, if we lose weight, for every 2 pounds lost, we lose a point. We can drop our blood pressure by a point. So that means if somebody who was not at a necessarily healthy weight and lost 20 pounds could drop their blood pressure by 10 points. Eating a heart healthy diet can change your pressure by 5 to 8 points. Drop it. Reducing our salt intake up to 8 points, 6 to 8 points. This is all on average. Eating more potassium-rich foods can drop our pressure by around 6 points. Avoiding alcohol, again, around the same. And getting active can have a significant effect. Aerobic exercise can drop our pressure by 4 to 8 points on average. Resistance training also is helpful. If somebody likes some light resistance training, and I encourage everybody to incorporate that into their exercise regimen, especially as we get older, because we start to lose muscle. Resistance training is helpful too. So there used to be a time when somebody would walk in an office and they were lifting weights and not doing a ton of aerobics, and the cardiologist would yell at them and say, "Oh, you need to do more aerobic exercise, and I know you're doing the resistance training." It turns out that resistance training is actually very helpful. We like the mix of both, but definitely the resistance training is also helpful. So definitely that's something light resistance training, mild resistance training can be helpful. And then it turns out things like meditation that are guided by a professional can drop your pressure too. So there are situations when the pressure gets too low. Some symptoms of that can be dizziness, lightheadedness, especially when you're standing, blurry vision. Um, these things can happen. They're not common, but they certainly can happen. And that's why we want to work with I work with my patients to make sure that I find a blood pressure regimen that works for them. I would say almost 100% of people were able to find something that works, that controls their pressure, where they're not having a lot of side effects or any side effects. All right, so it's really important that you partner with your healthcare professional. You want to stick to the plan in terms of what's prescribed. Um, if you have a side effect, what I tell my patients is, tell me. Don't wait until the next visit because we can pivot. We can switch it to something else. And there's no need to lose time in terms of, if you have a side effect to a medication, which can happen, we just switch to something else. And the good thing is we have a lot of options for high blood pressure medications, and we can generally find something that works for the vast, vast majority of people. Ask questions if you have concerns about side effects, and always let your doctor know. Um, be in touch and be clear about over-the-counter medications. Unfortunately, just because something's a supplement, for example, doesn't mean it's necessarily not interacting with other medications prescribed by you. And some of those supplements can even cause some issues. I'm not talking about taking vitamin C or taking a multivitamin, but there are a lot of supplements out there, none of which are regulated by the Food and Drug Administration. And sometimes they can contain other things that aren't intended, and those can have interactions and causes unintended consequences. So it doesn't mean don't take any supplements, but just make sure that your doctor knows what you're taking. A special situation is pregnancy and high blood pressure. Women with high blood pressure who are planning pregnancy or are pregnant should definitely talk to their healthcare professional. Counseled about the benefits of a baby aspirin to reduce the risk of something called preeclampsia. And that's a conversation that should happen as early as possible. And it's a good team. It should be a team approach in terms of addressing the high blood pressure if it's happening during pregnancy. All right, so what are some key things to remember? So high blood pressure is very common, and it's also, unfortunately, a common cause of heart disease, heart failure, dementia, stroke, kidney disease, and a lot of other things. High blood pressure is the most modifiable risk factor for major cardiovascular disease that we have. And what that means is that if we address high blood pressure, we can really reduce the risk of a lot of these consequences, which we want to avoid. The good news about high blood pressure is that it can be treated, and in some cases can be prevented by making healthy choices such as eating well, exercising, and taking medications as prescribed. Healthcare professionals want most adults with high blood pressure to keep their blood pressure below 130 over 80. Those numbers may differ for people who are very sick, older, or pregnant. So you want to check with your care professional and make sure that you're in touch with them about any questions. All right. So uh, I hope that was a comprehensive overview of high blood pressure. And I just want to see if there's any questions.
Thank you so much, Ahi. That was really wonderful and certainly very comprehensive. Um, Please, if anybody has questions, please put them in the chat and I'm happy to ask them. But first, I'd just like to start by asking you a question. When you said that hypertension is a silent killer, what does silent mean?
Yeah, so I think that's a great question. So um, a lot of people think that they can feel when their blood pressure is high and can feel when there's a problem. And usually you can only feel your pressure and when it's extremely high. And so I don't want to put an exact number on it, but 180s, 160s, 150 is the top number. The bottom number is above 100. Generally, most people don't have any they don't feel the blood pressure. And so that's why it can be so dangerous because even though we don't feel it all the time, those high blood pressures are causing damage to our organs and things that aren't necessarily visible on the outside. And while that damage is happening, it builds up and then it can lead to, unfortunately, very severe consequences, such as heart disease and stroke.
Thank you for that. And, you know, as healthcare providers, we want our patient's blood pressure to be less than 130 over 80, but is your goal the same as my goal? If somebody has diabetes or kidney disease, do their goals differ? What is the number we should truly be aiming for?
Yeah, no, that's another great question. For most people, the goal for treatment of high blood pressure, whether that's your stage one and this is lifestyle changes, or started on medication, is to have that blood pressure below 130 over 80. That's for the vast majority of people. If somebody doesn't have anything else going on, no other things like diabetes or anything like that, and they're completely healthy, and they're sort of in that stage one zone. Um, Sometimes, we may watch them and see how they're doing and see if they can give them some more time to see if they can get that pressure down with lifestyle changes. But after a certain period of time, we generally want to get most people below 130 over 80. And that number isn't necessarily magic. It's been studied and shown. So sometimes it's a little confusing because these numbers change. In the past, it used to be 140 over 90. And in the
Hmm.
past, it used to be that, oh, as we get older, it's okay. We want to let our blood pressure be a little bit less strict about it. Well, it turns out that research showed that if we do that as people get older, they just have more heart attacks and strokes. And so we should be treating somebody who's 85 and doing okay and functional and doing, what they need to do, the same as somebody who's 40 years old.
Yep, that sounds great. Um, you talked a little bit about checking blood pressure at home and how important that is. Is there a particular time of the day that patients should check their blood pressure? And also, what machine, do you have any preference of what kind of blood pressure machine they use?
Uh, yeah, no, those are great questions. So I'll approach the first one. That's a very common question. When should I check my blood pressure? So when I have people keep what I call a log for me, which is to check their pressure for a few days and record the number, I generally ask them to check the pressure twice a day. That can be in the morning and in the evening. Generally, and you can definitely chime in and let us know what you do. Generally, in the morning, I would say check it before you take your medication. If you take medications in the morning for blood pressure. But generally, I ask people to keep a log. I tell them to check it twice a day just so we have the numbers for a couple of days. But if you're checking your pressure at home, it's when you'll remember to do it. We don't necessarily have to check our pressure every single day for the rest of our life. A lot of times once we get that information, what's going on at home, and our blood pressure is under control, we don't necessarily need to be checking our pressure every day. Because sometimes that can even make people anxious. So we
Mhm.
want to, balance both things.
Yeah, I was gonna say like sometimes when we ask patients to keep blood pressure logs, they check their blood pressure like 4 or 5 times a day, and that just makes them a little bit more anxious. So I do tell patients to find a time of the day that you'll remember and try to check it consistently at that time and in the correct way as you delineated in your talk. Um, Another question that I had is when should patients come see a cardiologist for their high blood pressure?
Yeah, no, that's a good question. And the this is a hard because, if we don't know what our blood pressure should be, how are we supposed to know when maybe we need to take another step to get it under control? And so I think education is very important and understanding that yes, we should be aiming to have a well-controlled blood pressure, keep taking into account everything else going on. So I would say that if somebody has concerns about their blood pressure, it doesn't hurt to look up a high blood pressure specialist, which can actually be a cardiologist or a kidney doctor, and go see them, and that's okay. Um, so not every cardiologist actually is automatically going to necessarily do a better job addressing the pressure. So I think it's building that trust and having the knowledge to understand, okay, maybe my pressure's not where I need it to be. And there's no problem getting a second opinion, especially from somebody who does high blood pressure all the time.
Great, wonderful. Since we have a little bit of time, maybe do you want to talk to us a little bit about the types of medications that are used for high blood pressure and our first line meds in terms of antihypertensives?
Yeah, no, that's a good question, and it would be impossible to list all the
Hmm.
medications, obviously, but there are certain classes of medications that um, we say are first line blood pressure medications. And so those include a group of medications called calcium channel blockers, of which luckily there's basically just a few examples. Those include a drug like amlodipine and nifedipine. There are, in short, things called ACE inhibitors and ARBs, and those include examples like lisinopril or losartan, valsartan, olmesartan. And then there's another important class of medications called thiazides, which also, luckily, there's only basically a few of them. And those include hydrochlorothiazide, something called chlorothalidone, and another drug called indapamide. Um, and then sometimes once people are on these medications and they need something else, then we start thinking about other things. But the important thing is that people get on those first line blood pressure medications. The good thing about them is that all of them are generic, and a lot of them come in fixed dosed combinations. And what that means is that you can take one tablet that actually has two medications in it, and it just makes people's life easier. It turns out that most people respond better, especially if you're stage two high blood pressure, that 140 over or 90 or above. It turns out that most people respond better to a combination of two medications that work differently than to a really high dose of one medication. So I try to educate my patients and say, listen, just because it's two medications, we still get you on one tablet, and it may control your blood pressure better. Because I think sometimes people get in their head, oh, now it's two medications instead of one, and don't worry about that. Let's get your pressure under control. Let's get those lifestyle changes done, and maybe we can cut back. So yeah, so I think the good thing is there's a lot of options, and generally we can find something that works for most people. Sometimes I get referrals, and people are not on first line blood pressure medications, and I switch things and get them on first line blood pressure medications, and their blood pressure is well controlled, and they think it's magic. And it's not magic. It's just that we know certain medications work better. And that's what's important about having a provider you trust, and if you need to see somebody who does treat a lot of high blood pressure, as we call specialist, high blood pressure specialist.
Thank you so much, and thank you for all of those answers to these questions. Um, I don't see any questions in the chat, so are there any last thoughts that you wanted to share with our audience?
Um, no, I appreciate everybody came out. I hope people learned something from this talk, and I'd say the most important thing, a lot of this information can be, I don't want it to be overwhelming. I tell everybody this. You can't fix your salt intake and increase your potassium and do this and do that all at once. And you don't need to. The first thing is education. What is a normal blood pressure? Where should I be? What can I do to work on it? And how can I work on it allied with my trusted healthcare professional? And I'd say starting there.
Wonderful. Thank you so much, Dr. Akabwe. That was great. Hope everybody enjoyed the talk and learned some very important things about this very interesting topic and important topic. Hope everybody has a great rest of their evening.
All
Thank you
right.
so much.
Thank you.
Yes, thank you both.